Imagine for a second that you are sitting in your doctor's office and they deliver the news that nobody wants to hear, that you have early signs of heart failure, or maybe that your thyroid has completely shut down, or perhaps that your kidneys are failing. You start the medication, you worry for weeks, you change your entire life, only to find out later that you never actually had the disease. The machine didn't malfunction, and the lab didn't mix up your tubes. The error happened because of a single cup of black coffee you drank that morning, or maybe because you stood up when you should have been lying down. Today, we are going to walk through the 10 critical mistakes that ruin blood tests, 5 that you might be making right now without realizing it, and 5 that your doctor or nurse might accidentally make while drawing your blood, so you can protect yourself from a diagnosis you don't actually have before we dive into this invisible world of your blood. If you want to take control of your health and understand what's really happening inside your body, just take a quick second to hit that like button and subscribe to the channel, because we are going to peel back the layers of medicine that usually stay behind closed doors. And I want you there with us. Now, just a quick reminder that while I am a doctor and everything we're discussing is based on rigorous science and guidelines from top medical organizations, which I've listed for you in the description, this video is for educational purposes, so always verify your specific situation with your own healthcare provider. Let's start with something we all do, something that seems so innocent that most patients will look me in the eye and swear they were fasting, even when they weren't. We need to talk about the black coffee and gum myth. You've probably been told to fast for 8 to 12 hours before your blood work, and logically, you think that just means avoiding calories, right? So you wake up, you have a cup of black coffee because it has 0 sugar and 0 calories, or maybe you chew on a piece of sugar-free gum to freshen your breath. But here's the problem. Your body is a chemical engine, not just a calorie counter. Caffeine is a potent diuretic, meaning it forces your kidneys to flush water out of your bloodstream. When you lose that water, the liquid part of your blood, the plasma, decreases in volume, but the solid stuff, the red blood cells, the proteins, the calcium stays behind. This creates a condition called hemoconcentration. It's like boiling down a sauce. It gets thicker and more concentrated. If you go in for your blood draw in this state, your results might show falsely elevated hemoglobin, high red blood cell counts, or skewed electrolyte levels, making it look like you are dehydrated or have a blood disorder when you really don't. And that gum, even if it's sugar-free, the physical act of chewing stimulates the vagus nerve. This triggers what we call the cephalic phase of digestion. Your stomach starts churning out acid, your pancreas wakes up, and hormones like gastrin and pancreatic polypeptide start flooding your system because your body thinks food is coming. This can subtly alter your glucose and insulin levels, even if you haven't swallowed a single calorie. So when we say fasting, we really mean water only, because we want your blood to be a calm, neutral baseline, not a chemical storm reacting to your morning routine. Now, moving on to a mistake that is becoming a massive silent epidemic, especially for those of you who are trying to improve your hair, skin, or nails, we need to talk about biotin, or vitamin B7. Millions of people take high-dose biotin supplements, sometimes 5 or 10 milligrams a day, to get that healthy glow. But there is a huge disconnect here, because while biotin is great for your hair, it is absolutely catastrophic for modern lab tests. You see, many of the machines we use to measure hormones utilize a very specific chemical bond, the bond between biotin and a protein called streptavidin, to anchor the test antibodies. It's like using a specific shape of Velcro to catch the molecule we want to measure. When your blood is flooded with the biotin from your supplements, it gums up that Velcro. It gets in the way of the test reaction. The scary part is that it can affect tests in opposite ways. For a test like troponin, which we use to diagnose heart attacks, excess biotin can block the signal, creating a false negative. That means you could be having a heart attack, but the lab result looks normal. Conversely, for thyroid tests like free T4, it can cause a false positive, making it look like you have hyperthyroidism or Graves' disease when your thyroid is actually perfectly healthy. The FDA has actually issued safety alerts about this because people have been misdiagnosed and treated for diseases they don't have. So if you are taking biotin, you need to stop it at least 48 hours and preferably a week before your blood test. Speaking of the thyroid, that brings us directly to our third mistake, which happens to millions of people taking thyroid medication like levothyroxine or Synthroid. You wake up, you take your pill like a good patient, and then you head to the lab. It sounds like the right thing to do, but it's actually a major error. When you swallow that pill, your blood levels of T4 spike transiently as the medication is absorbed, peaking about 2 hours later. If you get your blood drawn during this peak, your free T4 result will be falsely elevated. Your doctor might see that high number and think your dose is too high, so they lower your prescription. But that high number wasn't your steady state, it was just the absorption spike. So you end up on a lower dose than you need, and a few weeks later, you start feeling tired, sluggish, and hypothyroid again. The golden rule here is simple. Skip your morning dose on the day of the test. Get your blood drawn, and then take your medication immediately afterwards. That way, we are measuring the true baseline level that your body has been running on for the last 24 hours. Now, let's talk about the gym mistake. You want to be healthy, so you hit the gym hard the day before your annual physical. You do some heavy lifting, maybe go for a long run. You feel great, but you have just injured your blood test results. Intense exercise causes microscopic trauma to your muscle fibers. It's normal, it's how muscles grow, but when those muscle cells repair themselves, they leak enzymes into the bloodstream, specifically creatine kinase, CK, and liver enzymes like AST. If you have a blood test the next morning, your doctor might see these elevated enzymes and panic, thinking you have liver damage or a muscle wasting disease. I've seen patients undergo ultrasounds and months of worry because of a workout they did 24 hours before a lab draw. Exercise also temporarily boosts your white blood cell count and can change your kidney markers like creatinine. So, if you have a routine checkup, keep your physical activity light for at least 24 to 48 hours beforehand to avoid these false alarms. The final patient mistake is one of the most fascinating aspects of human biology, ignoring your internal clock. Your hormones are not static. They pulsate and wave throughout the day in a circadian rhythm. Cortisol, your stress hormone, is naturally highest at 7 or 8 in the morning and drops to its lowest point at midnight. If you sleep in and get your cortisol tested at 4 p.m., it will look low, potentially mimicking adrenal insufficiency. On the flip side, testosterone in men peaks in the morning and drops significantly by the afternoon. If a young man gets his testosterone checked at 3 p.m., the result could be 30% lower than his true peak, leading to a false diagnosis of low testosterone and unnecessary hormone therapy. Even your TSH, the thyroid signal, has a rhythm peaking while you sleep. To get results that can be properly compared to medical standards, you really need to be at the lab early in the morning, ideally before 10 a.m., and it's not just about convenience for the lab, it's about matching the biology of your body to the reference ranges we use. Now, I want to shift gears. We've covered what you can do, but what about the person holding the needle? You are trusting them with your health, but even the most well-meaning professionals can make mechanical errors that distort your results. Let's talk about the tourniquet trap. We've all felt that tight band on our arm. It's necessary to find the vein, but if it stays on for too long, specifically more than 1 minute, physics starts to work against us. When the tourniquet is tight, arterial blood pumps in, but venous blood can't leave. This builds up pressure, forcing water out of the blood vessels and into the tissue, leaving the cells and proteins trapped inside the vein. This is called hemoconcentration, and it can falsely raise your protein levels, your cell counts, and most critically, your potassium. If the tourniquet is too tight or left on too long, cells can get stressed and leak potassium, causing a result called pseudohyperkalemia. This is a common reason for panic calls from the lab about critical heart rhythms that aren't actually real. And if you feel that band has been on for a long time while they search for a vein, it's perfectly reasonable to ask them to release it and let your arm rest for a minute before they stick you. The next provider error is surprisingly simple: gravity. We call this postural pseudoanemia. When you are standing or walking around, gravity pulls fluids down into your legs, and some of that fluid leaks out of your blood vessels into the tissue. This keeps your blood slightly concentrated, but when you lie down in a hospital bed, that fluid rushes back into your bloodstream, diluting your blood. Studies have shown that your hemoglobin and hematocrit, The measures of your red blood cells can drop by 10% just by lying down for 20 minutes. If a doctor doesn't realize you were lying down when the blood was drawn, they might think you are actively bleeding or losing blood, leading to unnecessary scans or even transfusions. Conversely, if you stand up, your white blood cell count can jump. Standardizing your position matters. For routine outpatient labs, sitting quietly for 15 minutes before the draw is the best way to get a stable, accurate number. Now, let's look at the hardware itself. Mistake number 8 involves the IV catheter. In the hospital, if you already have an IV in your arm, it's tempting for the nurse to draw blood from it to save you a second stick. I get it. Nobody likes needles. But plastic IV catheters are soft and collapsible. When we hook a vacuum tube or a syringe up to them and pull back, the pressure can cause the catheter to collapse or create turbulence, like a jet stream inside the vein. This turbulence shears the red blood cells, ripping them apart. This is called hemolysis. When red cells burst, they dump their contents into the plasma. Since red cells are bags full of potassium and enzymes like LDH, a hemolyzed sample will show dangerously high potassium levels that, again, aren't real. And it can also ruin coagulation tests while it hurts a bit more. A fresh stick with a straight steel needle is almost always cleaner and more accurate than drawing from an existing IV line. Mistake number 9 is all about chemistry and the order of draw. You might have noticed that blood tubes have different colored caps: purple, green, blue, red. These aren't just for decoration. They indicate which chemical additive is inside the tube. The purple top, for example, contains EDTA, a chemical that grabs calcium to stop the blood from clotting. The green top has heparin. If the phlebotomist draws the purple tube before the green or red one, the needle can pick up a tiny microscopic trace of EDTA and carry it into the next tube. This tiny contamination is a disaster. The EDTA travels into the chemistry tube and chemically binds all the calcium in that sample. The result? The machine reports a calcium level of 0, which is incompatible with life, and a skyrocketing potassium level because EDTA is a potassium salt. It's a classic contamination signature that confuses doctors and leads to panic. There is a strict international standard for the order in which these tubes must be filled to prevent exactly this kind of cross-contamination. Finally, we arrive at the 10th mistake: temperature. Once that blood leaves your body, it is a living biological sample that starts to degrade immediately. Some tests are incredibly fragile. Take ammonia or lactate, for example. These are waste products. If the sample isn't put on ice immediately to stop the metabolism, the blood cells in the tube will keep producing lactate, and the result will be falsely high. On the other extreme, we have tests for proteins called cryoglobulins, and as the name suggests, these proteins clump together when they get cold. And if you are being tested for this rare condition, the sample has to be kept at body temperature, 37 degrees Celsius, from the moment it leaves your vein until it is separated in the lab. If the tube cools down on the ride to the lab, the proteins precipitate out, and the test comes back false negative. Handling the sample is just as important as drawing it. So, there you have it. The journey of your blood is precarious. It's affected by your morning coffee, your vitamins, your workout, the time of day, the tightness of a tourniquet, and even the temperature of the truck that drives it to the dye lab. But here's the good news. Now you know you are no longer a passive participant in this process. You are the guardian of your own sample. So you can choose to fast properly, you can time your medications, and you can speak up if something doesn't feel right during a draw. By eliminating these variables, you ensure that the numbers on that report reflect the truth about your health, not just a pre-analytical error. It gives you the power to act on real information, and that is the most important tool you have. If you found this helpful, please share it with someone you care about. It might just save them from a false diagnosis. Check the description for the list of trusted sources we used to build this guide. Stay curious, stay healthy, and I'll see you in the next one.